Scotch again. Now, what we're going to take you now is what an operating theatre looks like, okay? So if you can see, this is the main entrance and exit to the operating theatre, but that's not used when bringing the patient in, okay? That normally used as an exit for patients to come out. So here is an area called the anaesthetic holding bay. So if you come through, normally you'd be brought in through the corridor and you'd be rested here for NCU. At this point, the nurse will come, the anaesthetist will come, and I will come and talk to you, try and make you at ease. The anaesthetist's job is to talk to you, put an IV cannula in, give you some pre-sedation to make you nice and calm. The nurse will come in before that's done to make sure that you're the right person, having the right surgery done, and it's been done on the right side. And one of my assistants or myself will come and mark your leg to make sure we don't ever make a mistake and operate on the wrong side of the limb. Human beings have two sides, left and right, and if you do the wrong side, it's absolutely a disaster. Okay, so if you come this way and follow me, okay, so this is anaesthetic holding bay, and then as you come through, you will go through the theatre behind these doors. These doors will open up when they're called for you, and you will go through the theatre. However, as a surgeon, I'll be going through this door, which is what they call the scrub bay. So if you come through over here is the surgical scrub bay. So this is where we wash our hands. The anesthetics are here, the masks are here, the scrub brushes are here. And once I've done my scrub, then I will walk through this door. And if you come through here, as you can see, we are now entering the theatre itself. So you come to here, you have entered through that door in, and here's the patient who is now being given anesthetic. This is our anesthetist here, that's the anesthetic nurse, and you can see behind there is all the surgical gear that's going to be used. So as you come through over here, so this is where my scrub gown is kept. When I come through here, having scrubbed, I put the gown on. This is the trolleys, called the surgical trolleys, come through this way, where this is the scrub sister who's going to be helping me give me the gear that I need to do the operation with. And that nurse at the back is called a scout nurse. So when I want something that's not on the tray, she will go out and get it. There is the store. That door is open, so if I want something, she will exit through the door, get the gear, and come back. That's a more relatively sterile environment, okay? So if you turn around here, this is a patient, and this is the anesthetic bay, the anesthetic area. That's the anesthetic trolley, and all the monitoring gear is just over here. And over there on the side is a screen on which my x-rays are kept, so whatever I have to see, I can do. So essentially, that's how it works. Once again, this is the door you come through here. The anesthetist gives you the anesthetic, and then we'll do the surgery. We'll show you how we prep and drape you as well now. Thank you. I'm washing my hands, and this is called the surgical scrub. The first scrub is about 90 seconds, so once I'm done, I'll walk through the door there. So now I'm scrubbed. This is called being scrubbed, means I'm technically disinfected and sterile. So I've got a hood, I've got a gown on, and here this is my assistant who is prepping the leg. That has been an antiseptic solution that relatively disinfects the skin area, and that's Roy. He's holding the leg up. He's the theatre orderly, so he helps us get the patient ready for surgery. Once again, patient's here. We're just prepping the leg now, and I'll show you what the setup looks like next. So, you saw us prepping the patient earlier on, so now the patient is prepped, ready to be operated on. So here we are, okay? So all you will see, all I will see throughout the operation is just the leg and the knee, okay? So this is my operating space. That's the scrub sister. That's the working table, and those are the equipment that I need. Those are the equipment. There is the navigation module, the computer-assisted navigation module that I will see so that I know what angles I'm cutting the bones at, okay? So once again, patient table, the working table, and the instrument tray is just on the other side. So this is the surgical area, and then behind these drapes is the anesthetic area. So they look after the patient well-being. The patient's awake, listening to music. As I said before, it's got a spinal anesthetic, so the legs are numb, they can't feel any pain. Good, now we'll take you through the procedure.